Mike Gibson, I'm in telecall, and we're talking about the relationship between anxiety and depression and cardiac events. Ahmed, I read with great interest your article where you looked at this relationship. Talk to us a little bit about what you did and what you found.
We've been long interested in the impact that stress and depression has on the brain-heart connection. And we were moved from decades ago by the Inchart study, for example, where it showed that chronic stress associated with heart disease, and that it wasn't just a gentle nudge towards heart disease. It was as bad as smoking, for example. So we were pretty impressed by that. And we wanted to assess that further. And we'd had several other studies where we looked at brain imaging to assess that connection. It's one thing to ask a person how they feel. It's another thing to try to get quantitative data that looks at the brain and then relates it to the heart. And we and others have shown that the degree to which the brain has upregulated amygdala activity, limbic system activity, will lead to an increase in inflammation and sympathetic nervous system activity and ultimately higher cardiovascular disease risk. So we wanted to then ask, well, how does the diagnosis of anxiety or depression fit into all of this? So if a person has anxiety or depression, do they also have a higher risk that's mediated by some of these same pathways? So we went to our biobank. And in the biobank, we had 119,000 patients that we had done deep phenotyping on. And of those patients, we then ask, okay, let's look at the folks who have anxiety and depression and study them for incident cardiovascular disease. So after excluding folks with prior episodes of cardiovascular disease, we had 85,000 patients that we studied roughly. And a subset of those folks had imaging data of the brain. We had heart rate variability data, and we also had biomarkers of inflammation. Then we wanted to see how does that all fit together. And it became really interesting when we first started just asking about the relationship between anxiety and depression and heart disease. So one of the first things that we wanted to ask is, how strong is the association when you adjust for, importantly, lifestyle data? So exercise, sleep, things like that. What about the socioeconomic factors and medications? And what was interesting is that no matter how we adjusted, we found that the association was pretty robust, that there's a strong link between stress, depression, and cardiovascular disease. And it's really not explained at all by some of these other factors.
And,
Uh,
heart rate variability, some studies are using heart rate variability now to look at the response to antidepressants as an endpoint in trials. So there is a pretty good link there to heart rate variability. Is that right?
yeah, absolutely. So the whole thing about heart rate variability is it tells you something about the sympathetic nervous system. And if you have great variability, that means the sympathetic nervous system is more quiescent. When there is stress and depression, the limbic system is roaring. And as a result, sympathetic system is chronically upregulated. And so the downstream manifestations of that include increased in the outpouring of what we usually think of with the sympathetic nervous system. But the other side effect is the innervation of the bone marrow leading to more pro-inflammatory cell production chronically. In other
Mm,
words, in addition to revving up your sympathetic nervous system, it revs up your immune system.
mm.
And so those are two bad consequences of chronic stress and depression. And in fact, what we found when we did the brain imaging is that individuals with either anxiety or depression alone had elevated stress neural activity. Whereas individuals who had both anxiety and depression, and that's a construct that usually means just a more severe manifestation of the disease,
Right.
had even higher stress neural activity. And that's what we had expected, and it bore out that way.
And I guess I would like call that, some people, maybe I'm wrong, is that more of like an agitated depression where you put the two together?
In some cases, it's that way, but a lot of people would just see it as a more severe manifestation of the disease, that they're part of a continuum.
Hmm.
and you're just adding up the manifestations, indicating a more severe form. But another subset would be that more agitated.
So
Uh,
you might think -1 plus +1 equals 0, but you're taking, the absolute values here and it equals 2.
yes.
Yeah. What other links did you see to the cardiovascular system and the brain activity? That's fascinating.
So it drives up the sympathetic nervous system and inflammation, and that they both contribute to the eventual increased risk of cardiovascular disease. So there was an increase in that MACE risk, and it
Hmm.
increased in either depression or anxiety alone, but the combination was an even larger increased risk. And that's something that we had been seeing over and over. That surprisingly, that stress and depression, again, even in our analyses, are as bad or if not worse than smoking in terms of the association with cardiovascular disease outcomes. And what we also find is that it's modifiable.
That's what I was just going to ask. So if you looked at people who got antidepressants or some treatment, did it change things?
So it's interesting. Antidepressants, sometimes they're hard to find in terms of the impact in a cross-sectional study or in a biobank because it's only people who have more severe manifestations that are taking the drugs chronically. Where we do see really compelling data is when we look at lifestyle.
Hmm.
So, for example, when we look at exercise, we see a dose response in terms of the reduction in stress neural activity. And
Wow.
when I say stress neural activity, I want to make an important point. People usually just talk about amygdala activity as a shorthand, but really it's the amygdala relative to the prefrontal cortex. And what I'll say often to physicians who are thinking about this concept is I'll say, guess what? You probably have high resting amygdala activity than the average person. And in fact, we found that if you simply do an analysis, something simple, educational attainment versus amygdala activity alone, you'll see an increase in the amygdala by education. However,
Hmm.
when you adjust for the cortex, they end up with low amygdala activity. It's
Oh.
always the amygdala versus the cortex. If
Oh.
you go to someone with PTSD, for example, you'll find if a population with PTSD has very high amygdala relative to the prefrontal cortex. But if you look at the amygdala on its own, just in the amygdala, it's actually lower than healthy controls. It's always the relative activity compared to the cortex because the cortical signals to the amygdala are what quiet it down. As a physician, for example, you want to have very active amygdala activity. So you are responding to whatever your patient's needs are,
I
right?
think mine got chronically activated being in a cath lab
I was
for
going to say that. That's exactly
yeah.
right. But you want to have a healthy prefrontal cortex so that you can, keep things quiet until they're needed. And the kinds of things that really upregulate the cortex and lower the amygdala activity as a result, exercise and sleep. Exercise and sleep have a very nice effect on the prefrontal cortex and a nice dose response reduction in stress neural activity, the overall ratio and the downstream manifestations. Alcohol also reduces stress neural activity, but it does so through the amygdala. It's not making you smarter. It does not impact the cortex. Actually, at higher doses, it
Yeah.
lowers
You may
cortical
think you're
activity.
smarter at higher doses, but you're not smarter.
No, yeah, exactly right.
Wow. Well, I got to tell you, I learned something today. I had no idea about this ratio of the prefrontal cortex to the amygdala stuff and how that matters and what we can do to improve our prefrontal cortex and improve that ratio and how it all affects cardiovascular disease. I mean, this was fascinating. I just loved your work. I loved reading about it, and thanks for sharing with us today.
It's been an honor. So nice to catch up with you, Mike.